and welcome to today's episode of Marvelous Medicine. In short, today's topic is about yoga in the 21st century. Our speaker is Dr. Sakthi Karunanithi. He is the Director of Public Health at Lancashire County Council, UK. Dr. Sakthi did his MBBS from Coimbatore Medical College and MD from the National Institute of Health and Family Welfare, New Delhi. Then proceeded to UK to do his Masters in Public Health, and he was recently awarded the Honorary Doctor of Science by the Lancaster University. Dr. Sakthi is an experienced public health director, and his areas of expertise include population health management, evidence-based policy advice, and health promotion. Trained in yoga from the Temple of Consciousness in Ariyar, and has completed his MSc in Yoga and Human Excellence from the Bharatidasan University. Dr. Sakthi speaks extensively about yoga and teaches simplified Kundalini yoga and meditation. Thank you, Dr. Sakthi, for readily accepting our invitation to speak on Marvelous Medicine. Moderating the session will be Dr. Shanti Vijay Bose. She is a consultant yoga therapist and instructor practicing in Chennai. Dr. Shanti did her MBBS from Madras Medical College, after which she trained in UK for a brief period. Did her PG diploma in yoga therapy from Krishnamacharya Yoga Mandiram, Chennai, where she went on to work as a consultant yoga therapist and a faculty in the studies department. Dr. Shanti has done courses in yoga teaching and Vedic chanting, and strongly believes that yoga can help healing in a holistic way. Looking forward to listening to what is the current evidence for yoga being helpful in treatment in a holistic way. Over to you, Dr. Sakthi.
Thank you, Dr. Vidya. Hello, Dr. Shanti, and everybody. Can you hear me okay?
I think you need to speak a little louder.
Okay. Is that any better?
Yeah, good. Good.
Yeah, okay. Well, first of all, I really wanted to thank Dr. Balavenkat, who introduced me to Dr. Vidya. And I accepted it because I practice yoga, but I started realizing its applications actually in our practice of medicine not very long ago, maybe 5-6 years ago. Although yoga was around me and from childhood. So I thought I'll use this opportunity to share some of the thoughts that I've picked up along the way, and hopefully we will we'll have a conversation about where we see yoga fitting into modern medicine. Just a little bit more about my my practice and background. I'll start sharing the screen. Hopefully you can you see the screen?
Yes.
Yeah.
Yeah, perfect.
Okay. So I've titled it as Modern Correlates of Timeless Mind-Body Practice, just to bring some new language into modern medicine and bring yoga into the modern century. Because ultimately, yoga consists of a number of things which we will look into a little bit more in detail. But I've titled it as Modern Correlates rather than claiming any robust scientific evidence, because it is still very new in a modern scientific way to see yoga and evidence of yoga in some of the academic literature. It has really taken off in the last 3 or 4 decades, but it's still fairly new. So, and therefore I have titled it as Correlates rather than evidence-based, scientific evidence-based, which I do believe that there is that. And I just wanted to start with acknowledging 3 people really. First is my mom, who actually introduced me to yoga. She's a teacher by background. She's a head teacher, and without her encouragement, I would have never sort of turned back again. It was there during the childhood, but I sort of did it as a ritual, you know, Surya Namaskaram as a ritual. I didn't really question. I mean, I had lots of questions and I was a bit of a rebel. but she introduced me, and she was really persistent. She introduced me to Vethathiri Maharishi's teachings. I don't know how many of you know him. I hope most of you at least know him. He's no more, but he started this Art of Human Excellence, which is Manavalakkalai in Tamil. And that is where I really got into a little bit more detail about what actually is yoga in our culture and our heritage. But then it still remained as a cultural thing that we do. And I'm living here in the UK. I am practicing as a public health consultant. But it still has been more of a personal practice and a part of our culture. But then the third gentleman there, Satbir Singh Khalsa, he's practicing in Harvard Medicine, School of Medicine as an associate professor. But he's also a yoga practitioner, yoga teacher. He, along with a number of other people, many of them are actually in India, particularly in Imans. They published a textbook, which is really what really opened my eyes and built that bridge in my mind between what I was doing as a personal practice and what was really in our culture, to actually bringing it, and interested me in bringing it to the modern medicine. So that is, I just wanted to acknowledge the three people there, and the book that I have put there on that slide, The Principles and Practice of Yoga in Healthcare. I really strongly recommend, if you are interested in this subject. It's a really, really in-depth, useful reference book to hold on to, and it has also got a number of avenues to go down if you're really interested in research or indeed applying yoga in a day-to-day practice. But before I go any further, given that there's only how many people are here, I would like it to be interactive if possible, Dr. Shanti. Just to have an understanding of, are people here already practicing yoga, or you're just curious? Even if one or two people just say where you stand in the spectrum of just awareness or really practicing and embedding in your professional life as well, that would really help me understand. Anybody wants to shout or come in?
So this is Ritu. Hi, everyone. I'm Arvind Krishna's wife, and thank you for inviting me to this. Yes, so I've been an avid yoga practitioner for the last 3 years. I started in it because of my suffering. My son passed. But I found this path to be, I've been bestowed with lots of gifts on this path, and I just keep continuing on this path. And I'm also doing finishing my 500 hour of yoga teacher training. So I follow Patanjali's 8-limbed path. And also as a yoga practitioner, I'm very open to other venues. So I'm really interested in knowing. I'm also a pediatrician. So, and I've started to use principles of yoga in my personal healthcare practice. It's difficult because I practice in the US, so I cannot use it as people are suspicious. So I'm really interested to see, I would love to use this to benefit more people. So I want to see what your experience is and what other people want to say about it. But thank you for having me here.
Excellent. Thank you so much. Is anybody else wanting to come in, or shall I proceed?
Yes, doctor. Unlike you, I have started yoga practices much later in life, which I feel is the common situation for lots of people around me. So I think youngsters generally get bored and they're disinterested in it. And I think once you start searching for solutions, you tend to go into this body-mind practice. Yeah.
Yes. Yeah.
I feel allopathy is more into body practice, whereas yoga is more into body and mind practice. So.
Absolutely. I mean, it comes quite later in people's lives generally. And what Dr. Ritu was saying there as well, we really need to be careful in not, as medical practitioners, as registered professionals, and also in the interest of maintaining neutrality scientifically, and not to overimpose our personal beliefs Sorry, Mike, you need to probably mute yourself.
Yeah, Tuesday afternoon.
Why is the best time for you?
So Tuesday is, I'm looking at, so after to what day? What
Can
did
someone
you
mute
know the
Mike?
date? Oh,
Mike's
sorry.
Mike.
Hold on, Abdul.
Okay.
So my question is, so thanks for coming in, Sakthi. I've listened to some of yours already. The yoga bit, as well as the any kind of exercise, finally, it leads to some kind of breathing control and helping you in overall endurance. Now, there are different ways to achieve this endurance. Obviously, muscle training, jogging and walking. And this particular, when you get older, yoga becomes much more comfortable in terms of helping your breathing and then the endurance part. So along those scales, I'm just wondering, is it just that breathing is the main factor that's, all the exercise are focusing towards, or is it something you are helping with your yoga? And, obviously, when you help your breathing better, your mind, your calmness, everything gets better. So is there anything else other than that?
Yeah, great question. Great question. Thank you for asking that straight away. And I will emphasize that in the next few slides. And if I don't address that, please do come back at the end, Mike, if that's okay. I do think it's much more composite and comprehensive than breathing, although breath works could be quite a useful way of actually getting into some of the techniques of yoga.
There's Dr. Lakshmi Prabha also. She says she's practicing Attangaugam for, I'm pronouncing it wrong probably, for past 5 years.
Atanga Yogam, Ashtanga Yogam. Okay, fine. Yeah. There is, right from the off, I'll say this. There are lots of schools of yoga. They all teach many facets of yoga. And pretty much it depends on your personal preferences, how you learn, and the content as well. And it has not quite been standardized in the way you think through a modern medical lens, as in the glossary of yoga, the different types of practices within that. Every school has developed its own labels and glossaries, but there's broadly some similarities, which I will also highlight. But thank you so much for engaging in that first part of the discussion. So I'll move on, but before I move on, I'll just say this. We need to, as medical practitioners, registered professionals, we still need to maintain scientific neutrality in this, and we need to avoid imposing our personal views and practices in the patients and populations that we are working with. And I think it will take a long time before it is fully understood. And I will just say that right at the outset as a disclaimer. I'm not trying to impose my views or sell. I am trying to promote the awareness of yoga, but I'm definitely not claiming anything more than that. And it is not new. People, especially in our culture, when I say our culture, I'm meaning Indian culture, there is a long history of, but when I say history, there's a long record of yoga practice in different ways. And many of you may be familiar with this 18 Siddhas, for instance. They've all alchemists in the old language, but they've all also tried to bring about some kind of social benefit to people that they have lived with and worked with. And somehow there is some commonalities between them about the life that they lived, the practices they did, but not quite scientifically exposed as in the modern scientific language. But if you read their literature, much of that is very coded and codified and a bit mystic, and it's very hard to decrypt or decode what they've said. And I think there is a body of literature in Indian culture, and I would say in Eastern culture, in Asian culture, there is a body of knowledge that hasn't been quite well understood from a Western medicine point of view. Right. I'm going to share a few slides, starting with, and I'm attempting to develop a plain English narrative about yoga and its philosophy. But throughout the talk, I'll relate to what has been said, and I'll particularly refer to Patanjali's work. Sage Patanjali is a well-known father of yoga. He's written sutras, and he's tried to expose what it means, how to practice, and so on. But ultimately, yoga is defined as Chitta Vritti Nirodha, which roughly translates to stilling of the fluctuations of the mind. It commonly is understood as stilling of the mind, but it is actually stilling of the fluctuations of the mind, or at least attempting to still the fluctuations of the mind. So somebody asked breath works and how is that related to physical activities and the jogging and the exercises we do. Yoga here is defined as ultimately stilling the fluctuations of the mind. But in order to reach there, it is also defined as a combination of movement, breathing, relaxation, meditation, and interestingly, almost all the ancient literature doesn't actually stop there. It actually extends it to ethical living. So how do you treat yourselves and in relation to others, which is where I think there is a lot of modern applications here. Atanga Yogam, somebody referred to Atanga Yogam, and it's also Ashtanga Yogam, Ashta Angam, 8 limbs, and this is a commonly coded components of yoga in its totality, and that starts from yama, niyama, asanas, pranayamas, pratyahara, dharana, dhyana, and samadhi. I'll quickly mention, just highlight a few things in there. It starts with community ethics. So it's how do you treat others, which is quite difficult if you haven't attained some kind of equanimity or harmony within yourselves. But it starts like that. But actually, it's a cycle. You can start anywhere, and as long as people develop these skills across all these 8 components, it is thought that they have mastered or they are a yoga practitioner in its totality. So yama is about how do we treat others. Niyama is how do we personally treat ourselves. And those two are the first 2 components. The third one is the asanas. Asanas is the most common part of the yoga that is very well promoted certainly in the Western world. That is various yogasanas, sitting, standing, stretching, lying down, various postures. And then the pranayama, which is a very systematic breathing practice, which is meant to be the transition point between the physical components of yoga practice towards emotional, intellectual, mental, and psychological components of yoga practice. So out of this 8, the first 3, if you will, are more or less physical. Pranayama is physical, but it also includes mental. And after that, pratyahara, which is about understanding the inner awareness, the management of the 5 senses. And dharana is concentration, which is again a mental activity. Dhyana is meditation, and it's further deep concentration, again a mental activity. And samadhi is the enlightened at one, sama adi, so being equal to the beginning is how I interpret it and is commonly known. So there are 8 components or 8 limbs of yoga. And in my talk, I will draw out the modern correlates of how this relates to current day practice and current situation that we find ourselves. But before that, I'll draw on 1 or 2 other things. So these 8 limbs, you can roughly categorize them as first including the yoga practice, which is the eight limbs of yoga. But normally that doesn't stop there. It leads to more introspection. It leads to more consolidation of changing our habits. And the final part is the self-realization. Sometimes people call it God realization and finding peace. And that is the, at least the claimed goal for yoga practice. But there are lots of benefits that accrue. One doesn't have to reach the self-realization stage just by practicing the breath works and physical parts of yoga. People can gain some benefits in their health and well-being. And that's how the yoga practice leads one from starting the practice to self-realization. Now, from now on, I'll try to really draw the correlation between what is in the ancient and culture and literature about yoga and how it relates to modern day practice. Hence, I've called it as a metaphysics, anatomy, and physiology. Now, yoga and yogic literature is nested within the wider ancient Indian philosophy, which tries to explain the reality or the ultimate reality of things and that which perceives things. Now, one of the components of that is how do we understand the universe around us? And that has been exposed in literatures like the Brahma Sutra, for instance. Much of that translates into the 5 elements: the sky, the fire, the earth, the air, and the water. And if you just transpose that to a human body, those 5 elements are there in human body as solids, liquids, heat, the nervous system, the air. That's the modern correlate that you can draw on in terms of nervous system, respiratory system, circulatory system, digestive system. There's various other systems, endocrinal system, as an example. So yoga practice, certainly in the ancient literature, in our cultural heritage literature, it's about getting the balance of these 5 elements. So it's about how do you balance these 5 elements, and yoga meaning huge, meaning at one and in unison and in harmony. And if you really transpose that to human body and human physiology, it's about homeostasis. It's about how does one maintain the balance of all the parameters within normal limits, if you will. Now, this is something that we all need to take notice of, because the evidence of yoga and the scientific literature has really exponentially increased in the last 3-4 decades, as I was mentioning earlier. And now there is a lot more research going on, and they have started to describe physiological correlation, or at least postulation of how yoga might work in the modern world. And I wanted to dwell on this slide for a bit longer. So I already mentioned yoga practice, and this is from the textbook, actually. I've already mentioned yoga practices include postures, breathing, relaxation, and meditation. And let's look at how they all are correlated with the modern medicine, which I think is really marvelous. First thing is posture. Postures, various postures in yoga, they tend not to be too strenuous, as in like a jogging, or the one that really needs much exertion. They generally tend to be focused on flexibility, balance, strength, more than exertion. And that there is a direct correlation with that to our musculoskeletal system in attaining stability, in attaining the coordination, which again is one of the important things that leads to people falling, absence of coordination. And the respiratory function is an interesting one. Somebody, Mike, asked about the breath works, and we commonly correlate the breath with increased oxygenation and therefore more energy availability and so on. But what the literature seems to suggest is that there is a real direct influence of the breathing pattern with our autonomous nervous system. Autonomous nervous system being, there is a sympathetic part and the parasympathetic part. It is generally understood that certainly in the modern world, we are more on our sympathetic drive, stress, we're afraid of things, we're flying away from things, the fright, flight, fight mode. But breathing and systematically practicing various types of breathing that is taught through yoga practice appears to bring that sympathetic nervous system more in balance with the parasympathetic nervous system, mainly because of the stimulation of the vagal afferents throughout the viscera, but mainly through the thoraco, the thoracic, the extension of. Okay, so that is a direct correlation with breathworks and parasympathetic toning, and fitness, being stable, not falling, and that all leads to more self-efficacy, so self-worth. So that's one part of yoga practice and how it's related to the musculoskeletal system as well as the autonomous system. And directly linked to that is the self-regulation. Self-regulation, also understood as allostasis, which is how does body maintains its balance of all the parameters in the face of an external stressor. And again, yoga practice combined physical as well as mental components does appear to lead to more regulation of stress, particularly through the autonomic balance, but also through how one processes information. And that is more cognitive than your automatic, autonomous nervous system. And there is a big surprise waiting for us if we notice, because we have learned that the autonomous nervous system is basically automatic, and it's not something that you can voluntarily control. This is a general understanding. Now, there are various subtleties behind that, but central nervous system, which is your brain and your muscular, the peripheral nervous system, it is generally understood that we can control it, whereas the autonomous nervous system is not thought to be under control of, willing control of someone. Now, if there is a link between breathworks and autonomous nervous system and more parasympathetic toning, which if you extend the physiology and the anatomy of it into the hypothalamus and further up the chain and hypothalamo-pituitary, and how that feedback loop affects the rest of the endocrine glands, there is something to be unraveled there about the connection between breath and the autonomous nervous system and the endocrine system, and indeed the higher cortical functions, which if we are constantly under grip of external stressors, as we know in daily lives, we can't really think properly, or we can only think properly for a temporary period of time and we get fatigued. Now, Mike asked about the breath, and well, is it same as physical exercises? I'm not sure. There definitely appears to be the happy hormones released through physical exercises as well, but I'm not sure whether the type of breathing that is involved in pranayama, for instance, which has got different components, inhalation part, holding the breath part, as well as the exhalation part. I'm not sure whether you get that in your regular sort of gym works, for instance. So a question mark, really. I would like to argue it's different. It may be very different, but we haven't quite understood. But there does appears to be an avenue where we can voluntarily do the breath works that can directly influence the involuntary nervous system, if you will. So enough said about that self-regulation. Going on to awareness, and I won't go into spirituality because I wanted to keep it there, but happy to answer questions. But it is a bit of an elusive topic from a modern science and medical science point of view, but one that I think we can come back to. But awareness is something I want to pause there as well. There appears to be a lot of neuronal pathways, and this again is very much there in the current literature, especially with techniques like fMRI techniques. There does appear to be some link or association between practices, meditative practices particularly, which is directly correlating with reduction in mind wandering. And mind wandering, it doesn't help one concentrate or memorize and all that, but also it is associated with stress and depression, anxiety and depression. So if one develops the capability to reduce mind wandering through the dharana and dhyana practices, and dharana is concentration, dhyana is meditation, and it is often confused with mindfulness, which I am quite happy to address in the Q&A part of the session. But there does appear to be some neuronal pathways that gets activated that helps one to think better and to actually think about how one thinks as well. And that is also correlated with memory, retention and recall, and ultimately decision making. And that is important because in the current world, we can quite get distracted with everything else thrown at us through social media and the stresses of life, and the ability to make decisions and think and make decisions, particularly people in leadership roles. I think there is as an avenue to go down to explore the relevance of yoga in modern day practice. So if you put that together, that ultimately is about improving human functionality, physical, mental, as well as emotional and intellectual capabilities. I have started to already mention these areas already, but I just wanted to highlight some of the aspects which have really been explored in depth. And if people are interested in it, I'm quite happy to make links and pursue this outside this talk. But mobility and pain, yoga and sleep, blood pressure, very well understood. Pranayama and blood pressure seems to we have a positive relationship. All the other things I've said there, I'll just pick one or two other things. Interoceptive awareness or neuroception, which is having the ability to make decisions by tapping into all the senses that you have, and how to respond and not react to situations. And some of the new aspects like brain plasticity, this will definitely have some relevance to dementia research. It looks as if people practicing meditation have more plastic neurons that are very flexible than those who don't. And those all put together is what's being described in the literature as allostasis and autonomic regulation, and how the mind-body practices like yoga can help one develop those capabilities. So I then this is just me extrapolating things from what is said in the literature and what is plausible if you think about a biological logic. From yoga, one can get autonomic toning, and if you extend that into hypothalamo-pituitary axis, there is an avenue for reaching more hormonal harmony, and you extend that further into immune regulation is really well described in many of the modern literature. That, as well as the cellular level, cellular biochemical exchange, particularly the membranes, and this is again described in various books like The Biology of Belief and Bruce Lipton's work, how one can develop or retrain oneself using yoga as an avenue to develop those skills to achieve to enhance their cortical functions. But there are really a few limitations in what I've said. The first thing is we still don't have very objective measures of effects of yoga practice. Much of that is evolving now. Many of that is very self-reported measures, but with various techniques like fMRI and many standardized scales, there is a lot that's happened in the last 2 decades, particularly, that would help address some of those limitations. And the second thing is every yoga teacher, teaching school have codified this yoga practice under different names, and it's very difficult to compare the effects of one yoga practice with the other yoga practice without having that common nomenclature between. But Ashtanga yoga practice and those 8 components, certainly the 6 components that involves just the individual, is a useful lens through which we can look into how to study the effects of yoga. And I do believe that there are some significant implications in understanding quantum science, especially if you read some of the yogic literature and how they've described human body. So I'll just give you one example. Human body in yogic literature is understood as Stula Sarira, Sukuma Sarira, and Karana Sarira. Stula would mean physical. Sukumam means you can't see it, but it's that at the energy particle level, life energy particle level. And then there's a Karana Sarira, which is all at the force level. And there is a direct correlation with physics, modern physics and quantum physics, which I think we haven't quite tapped into, and that might be of interest to some people. So applications in modern science, definitely we can already start to see the direct implications of yoga in psychophysiological practice. But at the cellular biology level and quantum physics level, I think there's more research that's needed. How can this all help in the modern, certainly from my point of view as a public health practitioner, how can this all help? These 5 things I put there drives a lot of disease in a modern world. There's still a lot of infectious diseases out there and accidents out there, but most of the disease that profile that we see are long-term conditions, non-communicable disease that arises because of unhealthy eating and drinking, lack of sleep, not being very active, managing relationships between oneself and certainly the family is an interesting issue, and mental well-being. Now, practicing yoga is one way of achieving that self-efficacy and that autonomic regulation, which can help one to achieve better and healthier behaviors. Now, further, if you extend that further, I think we can extend it across the life course in our practice, starting well. Certainly children can develop more concentration, memory, recall, how that can help with their educational achievement, as well as the physical health benefits of that. Certainly in the working age, managing stress, family relationships. I have only just identified the issues that I see as relevant, but you will all have your own experiences to add on to. And as we go down the life course about aging well, and Mike again mentioned, as you grow older, you start to understand or want the need to learn about yoga and things that aren't strenuous, and indeed dying well, where that is another area where we really haven't fully explored how can the spirituality and spiritual side of things can help, not just in dying well, but throughout, but certainly more appears to be more relevant at that final stage of life. I'll pause it there. I'm coming to the end of my talk. Something for further explorations I've put there through this network and other networks that people are part of. There is really an area to explore and exchange further knowledge about this. We haven't really cracked this implications and scientific evidence base of yogic practice, and certainly in a modern sort of Western medical allopathic way. I'm not saying that's the only way, but it looks like an avenue to go down. There's something called social prescribing, which is prescribing social activities, including at workplaces, to keep workforce well and keep people well. There seems to be a role for yoga in that. Yoga as an adjunct to therapies across the disciplines. There's a lot written about cancer and lymphedema and yoga practice, and stress and yoga practice, blood pressure and yoga practice. There seems to be an area to explore, and Dr. Shanti is here, who has been a yoga therapist as well. So that's an area where we can't say yoga can replace the therapeutic modalities. Certainly, I wouldn't say that, at least now, yet. But there seems to be a role for yoga as an adjunct across all disciplines, I'd argue. And I think there's a lot more to do further research on the neuroendocrinal pathways, the immunology and epigenetics, and increasingly the metacognition and the role of yoga in understanding consciousness. I'll leave it there. There's a lot more that we can go on, but I'll leave it there. The final one being, can we and are we ready, and is modern medicine marvelous enough to embrace yoga as part of modern medical practice, is something that I'm interested to explore, and how we can translate that knowledge into our habits. But thank you again, Dr. Vidya, and everybody for giving me the opportunity. And I'm sure you can see certainly my passion, and I'm very happy to answer questions, and thank you for your time.
Over to you, Dr. Shant.
Yes, thank you, Dr. Sakthi, for a wonderful talk. It's very difficult to compress the entire topics that you have discussed in such a short time. You've done a very beautiful job of it. A few points I'd like to add about the biological correlates that you were talking about. As an antioxidant, I think there is some evidence which says that superoxide dismutase also, there is an increase of it in long-term practitioners of yoga. Yeah, so that is one thing. And I would like, based on your experience with COVID-19, what do you feel is the correlation with the current yoga practices? Because I feel there has been a resurgence of awareness and people are coming back. They want to learn. Post-COVID people we are seeing who have greater energy post an infection. The fear factor is addressed. The stress factor is addressed. What are your thoughts on it, Dr. Sakthi?
Thank you. Thank you. Yes, there's a lot that I didn't go into the details about the biochemical, the biochemistry pathways. And actually, if you correlate the Krebs cycle, which is a boring subject, certainly for me it was, but now I'm sort of developing more interest in that. But there's a lot to be said about that. But on the long COVID and COVID, there has been a resurgence of yoga practice during COVID, and even in the UK, I know one of my friends who is involved in the long COVID research, Dr. Manoj from Leeds University. He was telling me the other day, institutions like NICE, the National Institute for Clinical and Health and Care Excellence, they have recommended practices like yoga can be helpful in people recovering through long COVID. I will admit, I haven't really looked into the long COVID research myself, but it is plausible. It's definitely plausible that people will be benefiting from that. And ultimately, if there is a correlation between breathworks and right from breathworks to immunological pathways, it is plausible to think that it will help people to recover well from an infectious disease. That I'll probably leave it there. I don't have anything more to claim anything scientifically.
Thank you.
Oh, the oxygenation. Somebody has asked about oxygenation. There's a fact. So normal vital capacity is about 1/2 liter. If you do deep breathing, it can be 4 or 5 times more than that. Sometimes it can be 7 times more than that. So there is definitely something there. Somebody's posting there in the anesthetic practice, and I've learned, again, this is anecdotal evidence, and some of the anesthetists here will be able to validate. If you're really in a rush to get the quicker benefit from the induction, I have heard that people ask patients to take 4 or 5 deep breaths and then induct people into sleep. But I don't know how much prevalent that is. But I'll leave it there. Thank you.
Dr. Shanti, there are 2 hands up, Mike May and Ravi. So Mike May, would you like to go first? Unmute yourself. Yeah.
Thank you. Thank you, Shakti. And as usual, that was great. But again, the reason why I joined today is to see if I can get more information, but you are unfortunately being circumvented to, give that bigger picture rather than, going into details. I do agree with all of your, the plausible theories. So one example, when it comes to how the breathing can control or regulate your autonomic nervous system. Say, for example, if you're breathing in a minute 16 to 18 times, and if you can control down to 10 or 8, so if you're going to lose, you usually lose as much heat through your breath. And if you're going to control it to 8, actually you are conserving body temperature, and your temperature is going to rise within 2 to 3 minutes. Your vessels has to dilate in order to sweat. So which meant you are relaxing, some kind of a vasodilatation is happening. So within 3 minutes, for example, if you're going to cover yourself with a blanket and you're going to try and control your breath. And controlling your breath is you are trying to force yourself out and just trying to hold as much as possible, but not breathing in as much. Now, yes, that's a simple experiment which you could try and say, yeah, there's something that or more to learn about it. Now, the other interesting element is, you do all your activities when you breathe out, say speaking to eating. So when you're breathing in, you're doing nothing. So for example, even lifting weight, you have to lift your weight only after holding your breath. You just cannot breathe in and keep lifting. Now, when you run, there's a brief thing where you breathe out more rather than breathe in quick. It's more like a swimming. So if you are focusing more on your breathing out phase more and more, this is where I'm focusing on this, how much your yoga by just sitting, when you focus on breathing out more, how much of benefit and endurance it's going to gain. And the last comment which I want to add is that measuring your yoga, results with the English stuff, the lung function and whatever, it's a bit, you're trying to poke an elephant blindly with a stick and trying to guess whether it is all, so the way I see is that the ancestors have done so much. They've gone around a circle and decided this is all preventive. Now, all the English medicine is all about superficial in terms of fixing things, but the prevention is just trying to work, but no one wants to go on the prevention, because if they go on the prevention, its business is gone, because alcohol, smoke, everything is gone.
Quite right.
So, so one way
I will address that. Yeah.
Yeah, it's putting down these ancient techniques is purely commercial, and this is where we are going to struggle quite a bit telling the patients, because there is something else going to distract as soon as they reach their houses. So I stop there.
Well, fantastic points. I hope I haven't come across as intentionally circumventious. It's just that we simply don't have robust evidence to claim anything in the way that we can scientifically claim. And people from scientific professional backgrounds, I think we need to be mindful of that. But absolutely agree with you about the breath being one of the really important, crucial ways of getting into that balance of the autonomous nervous system And there is much more than just the autonomous nervous system, which I don't claim to fully understand. But that is definitely one way. If you think about breath, vagal receptors, hypothalamus, and then from hypothalamus to cortical areas, as well as the endocrinal pathways and the immunological modulation you get. This is all plausible, right? But we don't have robust way. And then the the point about modern medicine, and this is high politics and economics and commerce, right? And there is a real difference between what our ancient ancestors have tried to do at a time when there was not much of antibiotics, not much of ramipril and all those things. So there is a real difference between yoga and the mechanism, which is about your helping your system, your own system, to be in harmony with the external. But in modern medicine, it's almost everything is external. So you take something from external, but yoga is more about internal. But there is a need for balancing both. And I wouldn't like to think that we can treat TB by meditation. That would be wrong. But the final point is patience. I think there is a social attitude and culture where we need instant results. I don't think we can say that yoga can give you that. No. And that means habits changing, behavior change. But it is possible, if it is part of your habit from early on, it is possible that we may become a bit wiser with yoga.
Definitely. Thank you, Shakti.
Ravi Shankar, your hands up.
Yeah, hi, can you hear me?
Yeah.
Yeah, so I have a completely different question, and that is, traditionally yoga, at least as it was practiced in India, was both physical and deeply spiritual. What I see, particularly in the United States, what's called yoga is very physical. Whatever else, it's mainly divorced of practically anything else other than something that's not very different from, say, practicing mindfulness or practicing, the nuanced breathing techniques, etc., which is just doing that. Is there any evidence that yoga practiced as it was supposed to, with the deep spiritual, roots, is different or similar to what's practiced today in most Western situations?
A great question. Thank you so much for that. This is one of my still it hangs as a question for me as well. If you really understood yoga, says he who hasn't, and I don't claim I have, but if you understand the fullness that is there in yoga, it is both physical, mental, emotional, intellectual, spiritual, as well as social, because the yama and niyama are more social. And by social, I also extend that to how you relate to your natural environment. And that's how it was thought, right? That's how, say, potentially codified it. How can a human being or human society, civilization live in harmony between themselves and with the nature? So that's the triangle, the self, the society, and the nature. Now, over time, and that is, I think, one of the curse of over-globalization, maybe, is that we have stigmatized spirituality to the margins. And I think one of the ways to reclaim that is to extend the practice of yoga into mental and emotional domains. And by that, I mean introspection, stress reductions, and that sort of, and mindfulness is a useful way of doing that. And I think as more and more we understand about the wider sort of metacognition, and that will, I think, open the domain into this spiritual dimension. But I do think there's a lot of stigma, or it is very ageist in that you only become spiritual if you are, nearing the end of your life. So I think there's a lot of a lot of stigma, and also religion. Yeah, let's open that box.
Yes, yes.
So
I know.
yoga
I
is
was
very
being circumspect.
yeah. Yoga is very much associated with Hindu religion, right?
Correct.
And I think there's a fact, but I think this predates religious ideas. This predates much of that, if you go back in time. And we need to talk about that. We need to engage in a dialogue between ourselves about that. And that's why I didn't particularly want to go straight into the spiritual dimension of it, because we get too overheated and the whole point about yoga being in harmony gets lost. But also the physical, just the physical practice of yoga has got a lot of health benefits, and we really don't want to miss that out.
Agreed. But going back to looking for objective evidence and evidence-based medicine, I mean, how would you do a study, number one? Because obviously the intervention is very clear, so you could have a study effect. You have, that's why I brought this up. So you have this,
well, okay.
I mean, you could do a study with traditional practice of yoga versus just the purely physical practice of yoga. Well, everybody's doing something there. It's easier to do a comparison in that situation.
Yeah. Oh, sorry. Have you finished?
Yeah.
Okay, so I'll approach it in two ways. One is the study instrument. If what we understand yoga is about direct experience, ultimately, obviously there are some physiological correlates. It's very hard to measure direct experience objectively using a scientific instrument, because you're always looking out to see something, whereas what you're actually measuring is pretty much self-reported. So there is a fundamental problem in the study methodology where I think we need to, yoga is itself a religion. Okay, we can have a separate debate about that. That's a really stimulating thought, the yoga itself is a religion. But go back to the study instruments. I think there is something about the methodology, about mixed methods and being open about self-reported outcomes as an outcome measure, as an effect measure, and so on. And it really is very difficult if you really don't. It's very difficult to do a randomized controlled trial.
Right, but patient-reported outcomes are becoming very popular these days.
Yeah.
And there are several of those PROs that are very well validated and can be used, particularly in wellness. So I don't think that's a problem. I mean, my issue with PROs is that they're too blunt. So it takes a large sample size to see differences. But other than that, I think they are pretty acceptable. In fact, they are extremely important in reimbursement agency assessments. NICE is huge on PROs. So, so patient-reported outcomes are not something that's taboo anymore. It's actually it's actually becoming a very well-evolved science. So it's not necessarily an issue. So
true. Especially if you combine that with some other objective outcome measures, it becomes really powerful as a methodology. Yes.
So Dr. Bade actually mentioned a couple of studies where measurable outcomes have been there. Dr. Bade, would you like to elaborate on that?
Yeah. See, a lot of trials are going on where yogasanas have proved that the diabetes can be treated and cured. Similarly, about hypertension. In Nagpur, there is one center where the doctors and the yogasanas and the yogic people, they have combined and done a randomized trial. And the trial is continuing, and it has been proved that various yogasanas have definitely helped in managing the diabetes patients. And some of the patients are now without insulin and without taking any of the tablets, and they are well controlled. So it is randomized trials are going on, and I think very, very scientifically they are going on. It is not like, and every time, no, we keep on talking about evidence-based medicine. So when you talk about allopathy, we say that allopathy has got evidence-based medicine. Now, if you tell me in the current epidemic of COVID, what happened? We kept on
Quite
giving
true.
so many medicines without any evidence.
Yes.
But
Well-
when you
well
talk
said.
about yoga, everybody wants you to show me evidence-based medicine.
Well said.
Actually,
Well said.
yoga definitely helpful in managing so many diseases, even like mental health problems. Then it improves wellness and promotes health. That is what major difference between the allopathic medicine and yoga. Yeah, mind well, I am also allopathic practitioner. I am anesthetist, but now I realized last 10 to 20 years that does help.
No, well said, sir. I'd be curious to really follow up on the trials that are happening, and but there is a bias. When we say evidence-based medicine, we really need to pause and think: what do we mean by evidence? What do we mean by actually basing our practice on evidence? And also, there is a lot of bias in terms of journals and what gets published and what gets promoted. So you're very right, and that's why I'm hoping that these kind of conversations actually help us promote the existing evidence that's available. Very, very well called. Thank you.
And there is one more thing: this Brahmari pranayam. It has been proved scientifically that it improves. It liberates nitric oxide from the pulmonary vessels and improves oxygenation. And it has come in our scientific journals also.
Thank you, sir. Thank you.
Thank you, Dr. Pade. Ritu, thank you for joining in. Do you have something to say after the talk and the discussions that have been going on?
Yeah, I was just typing here, but I'll talk now. Thank you so much. I think this was a great discussion. If yoga is the practical manual to live your life, somebody said it's a way of life. I would say Sankhya is the theory behind it, and it is very scientific. And it tells us how we evolve. And someone also talked about, I think Dr.Sakthi talked about direct experience. And when we say that the ultimate, out of the 8 limbs, the last one is Samadhi, and it's the union with the absolute, that's experiential. So we cannot sit here and read literature and use our intellect to understand that. We have to experience it directly. And we have all experienced it at some point, but we are not able to hold that experience. In order to be able to hold that experience, a lot has to be done. We have to become clean. We have to practice Shaucha, which is one of the yamas of Patanjali. It's the very beginning of the yamas. And I think Dr. Mike talked about the breath. So there are different kinds of breath. When we are exhaling and we are holding, prana and pranic energy and breath is all part of the divine according to the Upanishads. And we are giving up stuff like toxins, if we physiologically say, but we are giving up a lot of the things we don't need. We are cleaning up. We are cleaning up our sanskars when we are exhaling. And when we are inhaling, it's our evolution. It's the divinity coming to help us use our instruments to be what we are so we can fulfill our dharma. And when we are exhaling and we are holding, we are practicing that patience of letting go. So this is all very philosophical. And I think Dr. Ravi talked about practice of yoga in the West. And I will say that I've been so lucky. All of my teachers have been so close, which I did not realize. And none of them have had an Indian background. I have found teachers along the way, and I have got a lot of education from them. But when I started with my yoga practice and my philosophy lessons and my meditation lessons, I will say that people practice the whole Ashtanga yoga. And they practice it ethically, morally, and spiritually. So I think, and I would agree with Mike that yes, it's hard to tell people to do something preventatively. I've tried it in my practice to get children to do breathing, but there is one practical point I will tell you. The younger the child is, if they are around between the ages of 8 and 10, they are more readily accepting of trying. So there are various apps on the iPhone that help them do the breathing. And it may not be all pranayam breathing. It's very easy. It's a box breathing. You inhale like a square, inhale, exhale. And I have found that the younger they are more willing to practice it. And I practice it with them in the office, showing them the app on the phone. And immediately they feel so much better. I think they just withdraw, practice that pratyahar, and they go inwards. And the more you go towards your core out of all your layers, you are going to feel that peace, because that's the nature of your supreme, the absolute, is that satyam, jnanam, and anantam. And you will feel that. You will feel that, and you will bring it with you into the world. But to keep it going, you'll have to do all this effort. You'll have to do all the yamas, niyamas, and all that. I won't take much of your time. But I'm a complete practitioner, and I've been working on this, and I have a long way to go. But it was so wonderful to hear from all of you, and I'm just grateful. Thank you so much.
Ritu, maybe this is a question for you. Irene asked that, do you think yoga can be used in ICU for patients just after taking off the tube, which is the most, she's an anesthetist and an intensivist. So you think she asked, can yoga be used in the ICU, especially for post-extubation patients?
I do think so. So there is some kind of a breathing, and I'll have to find the reference to it. But we practiced this in one of our classes. We practiced breathing lying down. And it wasn't as intense as sitting up straight and keeping your spine erect and, doing this. But it's, I don't know if you've heard of Ramadasa. So it's like Ramadasa, so hai, so hum. And you just kind of practice it. And then you just, to a count of 3, Ramadasa, so hai, so, and then you hum, you just kind of exhale. And there's no effort involved in it, but you just inhale 1/3, you inhale 1/3, and you inhale 1/3, and then you exhale the whole third. So I think also music, yes, if it's a spiritual or a gentle music, sound or space is one of the most powerful of the 5 elements. And I was told by a guru once that if your senses are going to rob you and take you outwards instead of going inwards, then the sound is the leader of the robbers. If you control the sound, you have controlled all your other senses. So I think if you play gentle music in ICU, which helps them go inwards, it will be helpful. And there are breathing practices that they can practice lying down without making much effort. And I'm sure it will help with lung expansion, moving of the diaphragm. There are many books on lungs being the seat of pain in Chinese medicine. When a baby is born, baby can't breathe and the baby cries. And because of that cry, the lungs expand. They are full of fluid. The alveoli have liquid, but then the surfactant goes and it expands the alveoli. So the first breath comes from pain, and the lungs and the nerves remember that. And in anxiety, people get chest pain because the diaphragm and the diaphragmatic nerves are innervated. They cause spasms. So they have to learn to relax their diaphragm. So I feel that maybe in the ICU, if we can do some efforts to help them relax their diaphragm, do some gentle breathing, maybe play some music that, but everybody is at a different place. We also need to be aware of trauma triggers. Some people have things that can trigger their trauma. So in my experience, I have found that some people don't want music because it takes their mind in places where they have suffered trauma, and then they have this blockage. So I think being aware of who you are with and understanding their need instead of imposing our knowledge on them to see what's helpful to them. But we have to be open and understand, what do you need from me? What can I do? These are the options. Is this something that's helpful to you? That's just my thought process. So if anybody wants to share anything.
You could just type the app. There have been a lot of questions about the app. So if you could write the name of the app so that others could take it. And
app?
Okay. You said the breathing exercise app for children. And Galaxy A2 Core, I'm sorry, I can't find out what your name is. You seem to have a lot of points. Would you like to say something briefly? The person behind Galaxy A2 Core. Okay, so while we wait for that person, over to you, Dr. Shanti, to once again just, you know.
Yeah, regarding the research that is going on, and as Dr. Sakthi said, there is not much evidence based. One of the major challenges is yoga is not something you have instant effect on, as he said. So it becomes, the student compliance becomes a major deciding factor. We have done a lot of research in diabetes also. The starting student base is maybe 120. By the time people finish the 4-week course or 6-week course, the compliance from the students is not enough. This is one of the challenges we have faced. Probably other studies abroad maybe has a slightly bigger patient base, and to quantify things is even more difficult as far as yoga is concerned, though it is possible. Evidence has been, and the parameters to quantify are more restricted also. These are the two factors which is making concrete evidence-based research a little difficult as far as yoga is concerned.
Dr. Sugandhi, would you like to add something? Okay, I will just.
Thank you, madam. I'm here, myself, Dr. Sugandhi. Here we have done a research in COVID patients during the second wave, ma'am, in the Velamal Medical College Hospital Research Institute, Madurai. So it is in the process of publication, but I want to add to this. Those people have come just out of the ventilation in case of COVID, and people were in 6 liters of oxygen, because those people just with 2 days of practice, that depends upon their firmness and belief also. That matters a lot, and lot of encouragement from the other side as a trainer. So this Atanga Ogam and Pranayamam really benefited them, although they found very difficulty to practice in the first 2 days. But after a period of the 1 week, when they started practicing regularly, they did practice for only 20 to 30 minutes per day. It had a very good benefit, and no the post-COVID symptoms, as we know, some people had even nearly 3 to 6 months of the cough and all these things. These people didn't have it, and they, as they go into, and another point was that it was more, this practice is more acceptable by, because our patients are many are around 40 to 50. Average was 52 years. The acceptability in that age is thing. So what we are trying to do is something has to be done in the younger age, so that the habit is formed and it continues to their life to have a happy living. So that is one thing I want to add it on. Thank you for the opportunity, ma'am. Thank you.
Dr. Shakti, you said you had another meeting to go to. Do you have time, or should we close?
Yes, gone past that, but that's okay. But it's been wonderful. As much as I was preparing, I have also learned a lot from this. But one thing I would leave you, a couple of thoughts I would like to leave with. One is there's a difference between knowing and doing. I think that is something that we have not quite cracked. There's a lot of knowledge, but actually to turn that into practice and to sustain that practice, we need to understand how to do that. Should we start early with children? Should we make it like a game? Or should we really break it down into small pieces of activity? And that sort of thing is another area of interest. And then the final thought is, we really need to learn. There's quite a lot of there's quite a lot of malpractice or just overclaim there. So we need to learn from someone that has actually got some qualifications, is a trusted teacher or some sort of accreditation and that sort of thing. That can go contrary to, being very social and so on. But especially in trying to introduce yoga into medical practice, I think we need to have some more robust systems of assurance and the methodology to actually introduce it. So, but again, if people are interested in pursuing this further, I've put my email down there. I'm more than happy to pick up any conversation. And thank you again, Dr. Vidya, for actually asking me to be part of this. Thank you.
Radhakrishna, you want to say something?
Yeah, Vidya, a very sort of refreshing topic, I should say. And I think we just touched the surface of yoga. See, I always believed that yoga is taught by yogis. You know, we have long beards and long hair like mine. Shakti is almost there, although he looks like a modern version. He's a bit trimmed.
I'm in my office, sir.
Beard, whatever. No, I also thought that to learn yoga, you have to learn some religion. You should follow vegetarianism. You should do some chanting, and you have to follow some Ayurveda. I think that's a very intense sort of a yoga. I tried actually when I got scared seeing all that, because the physical part I can, but the rest of it I don't know how much I can adhere to. So that's when I left it, and then you should learn some Sanskrit and stuff is whatever. Shanti, I mean, I know whether the lady yoginis look any different from the real housewives, but that's how they. Maybe you wear that ochre color robes and pajamas or something. I really do not know. But there is a lot more, I think, a lot more to be discussed and talked than what we have done today. I keep hearing that this posture is good for pancreas and that yoga is good for liver. This is good for gallbladder. I think there should be some substance behind all that. For everything they have a thing. I wonder how bending backwards will make your pancreas function better. I really do not know, but I think there's so much more to be learned, and I think we should have a lot more conversation. And Dr. Shanti also should come up with some demonstrations, some practical tips and so on, that will induce a lot of doctors into it, and they will not scare them away.
Can I ask a question?
Absolutely. Please.
Dr. Anita.
Yeah, so I just want to know about yoga nidra. There's a state in mind in which you go into, the sleep pattern. It's supposed to calm you. It's supposed to help you. And in many stages, you find that people are actually conscious, but their eyes are closed, or they are snoring, or something like that is there. But they are aware of the surroundings. The minute the yoga nidra is over, and he says you can slowly get up, they do get up. They do feel a sense of, a lot of sense of calmness. So is that what it is all about? Because that also brings a lot of calmness to people. When I don't know much, but I just whoever can answer.
Well, great question. I have a partly philosophical answer to that. Yoga, one of the ways of describing and understanding yoga and meditation, davam, உறக்கத்தில் விழிப்பு நிலை, தூங்காமல் தூங்கும் சுகம், இந்த மாதிரிலாம் சொல்லியிருக்காங்க. So once you get into a state of awareness, and especially tap into your metacognitive faculty, it is plausible that you are aware of your sleep. But it's only philosophically possible. But before you get there, in my experience, there are lots of techniques for relaxation that itself is very useful in this, Dr. Anita. And yes, yoga nidra is a very well understood and taught practice, but you need to learn from someone who actually is practicing that, and not from YouTube. And I've seen a lot of people coming to me, oh, I've done this, my kundalini is awake, and do this, do that, and I don't know much about what's there in the YouTube, but something I would really urge against doing. So we can't learn to swim by looking at the YouTube, right? Cycle ஓட்டுறதுன்னா ஓட்டிதான் ஆகணும், ஒரு யாராவது ஒருத்தவங்க பிடிச்சுதான் ஓட்டணும். So there is something to be said about that. But a really important thing is about relaxation and sleep in yoga. And yoga nidra is a very well documented and taught subject. Thank you.
Thank you very much, sir. Thank you so much.
Your closing comments, Dr. Shanti.
Yeah, it was a wonderful talk, Dr. Sakthi. And in the current relevance in the modern world for yoga, which contributes to health, wellness, and disease as well in a complementary way, is really important because of the boom in technology. We see a lot of people coming with insomnia, shoulder issues, the more they go into technology, as much as there is advancement, you need something to compensate so you can handle the technology. That is a very important thing. And also I feel the lifestyle diseases has increased manifold as much as the technology in terms of modern world. So that addressing that is an entire topic in itself. And I think that those two, along with stress, is the major relevance for advancement and yoga in my understanding. Yeah. Thank you so much, Doctor. Thank you, Dr. Vidya.
I must once again thank Dr. Bala Venkat for putting me in touch with Dr. Sakthi. Dr. Sakthi for joining despite being in the middle of the week bang in the middle of the working hours. Dr. Shanti for readily accepting to be the moderator for this session. And thank you all 35 of you who were there all throughout. And I don't think we've had such an interactive session in a long time. So we'll reach out to you again, Dr. Sakthi, in the coming months, or maybe a follow-up on, or maybe a slightly different aspect. Thank you everyone for joining, and we'll meet again next week with yet another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.